Well, improving neighborhoods and their health. Joining me today to tell us more about a program that she's working hard with, Carla Thompson. She's Community Resource Navigator with Mercy Health and Crime Victim Services. And thanks for joining us today.
Thank you for having me, Holly. I appreciate it.
Okay, so this is kind of a new project. You're working with Mercy Health St. Rita's and this community impact team. So tell us more about your mission and what you're doing.
Our goal is to, I work with Abe Freisten here, who is part of the community impact team, and we work to kind of eliminate some of those barriers that people have to access and equity in healthcare.
Okay.
And that's really our mission, is to make sure that everybody actually has equal access to the healthcare needs that they have.
Mm-hmm. You're kind of focusing in on one area. It's, I think, kind of around St. Rita's, and it's your neighborhood, too. So tell us how the focus got onto that area through funding and research to what's needed there.
Right. So they realized that there were areas that were in greater need, where there were larger disparities. And so Census Tract 129 was designated one of Ohio's health improvement zones. And 26 different organizations were awarded grants from the Ohio Department of Health to help raise the quality of life and health in those different health improvement zones. And it just so turns out that St. Rita sits in health improvement zone Census Tract 129. And that also happens to be where I live. So it is what they decided to do was, with their grant, we're working, and I'm in a new position, the Community Resource Navigator, where I work with people trying to administer health needs assessments. And those health needs assessments cover everything from, do you feel safe in your home, to do you have food insecurity, to have you had your most recent cancer screenings? Do you have a primary health care provider? And so whatever their needs are as far as their social determinants of health, all those things that we know contribute to lifespan and quality of life, my goal is to connect them with the various and abundant resources that we have here in Lima, and not just hand them a pamphlet or give them a phone number, but to actually make that connection between them and the source or resource itself, kind of a warm handoff, and making sure that people are getting connected.
Right, yeah, because sometimes people know, but they don't want to take that first step. So you're kind of there to help them, okay, this is where you go for this, and we'll set up the appointment and things like that.
Exactly, because it can be pretty intimidating, especially when you're coming from a place of need or, extreme want. It can be very hard to figure out how to navigate those resources and who are the people you should be talking to and what kind of information you actually need to bring to the table in order to access things.
Yeah, you have a big job ahead of you. So I mean, it's your neighborhood, so I know you're passionate about it. And it's ironic, it's ironic that it's in the neighborhood where there's a hospital right there, but
I know, it's great. So Census Tract 129 is essentially Jameson to Metcalf, and Market to Delphus. And so within that small little area, I get to dive deep and really see if we can make some improvements, even helping people with quality housing, or affordable housing. So whatever we can do, and whatever agencies we can partner with and work with, I'm really proud to be part of Mercy Health's initiative in this role.
Right, yeah. I mean, it's such a big step. Are you kind of going door to door? I mean, how do you start this task?
Well, we have, I love the idea of going door to door because, that's the thing I get to do, right? But I do a little bit of that. Really, if people want to reach out with the information you had posted there, that's excellent. And then we are also hosting different health improvement events. So one initiative that Mercy has is we've restarted the Walk with a Doc program in a partnership with the YMCA, and we'll be doing that on a monthly basis with different healthcare topics. And I'm partnering with the resident team that's leading those Walk with the Docs and making sure that our Census Tract 129 residents get to actually make it there, and providing some assistance getting them there or incentives, whatever it is they need. And then we'll also be hosting monthly health improvement events starting in January. And those will be, come on in. We're going to have some cafe conversations in the cafe conference room here at Mercy Health. And we'll be talking about different healthcare topics. And particularly those meetings will be for Census Tract 129 residents. Other residents are welcome to attend, but we're looking at hour-long sessions where meaningful resources and information are shared. We feed, we fellowship with you, and really get to know you and what your needs are, and hopefully provide some of those needs for you in the process. Our first one is going to be January 11th, and we'll be talking about smoking cessation because from some of the assessments, needs assessments we've done, we know that that is a big one in the area.
Wow, yeah. Yeah, I mean, I think you want to give that personal touch, let them know, yeah, I do care about you. That's kind of one of those things. I think you build that relationship, that fellowship, that it's going to work.
Exactly.
Wow.
So
exciting stuff. Wow, what a great job. We'll have to follow up with you on what's happening. And thank you very much, Carla, for joining us.
Thank you so much. You have a beautiful day, Holly.
All right, you too. Thanks.